Hi, my name is Rel, and this is the IV push medication. Normally, we wouldn't be sitting on the floor here, but this is just for demonstration purposes only. So, using my iPad as the MAR, I see I have Ellen Davis, 9/19 date of birth, no known drug allergies, so we're good on that. So the medication is furosemide, 20 milligram IV push as needed. This is going to be for weight gain over 3 pounds in a 24-hour period or symptoms of fluid overload. And it's going to be given over 2 minutes, and we're going to flush with 3 ml normal saline before and after. So basically, that's going to be 1 ml every 60 seconds and 0.5 ml every 30 seconds. So let me tell you what I have here. So we have the 0.9% sodium chloride. This is going to be 10 ml of this, so we need to dispose of 7 to get 3. But they're both 6/1/2024 expiration date. All of these are good. And then next we're gonna have the furosemide. This is 100 milligrams, 10 milligram per ml. This is for 2031. Expiration date looks good. And then we're gonna be using a 22 gauge needle. The expiration date looks good on this, 5/31/2027. Normally we would be using a blunt needle, but we don't have that right now, so we'll just use a 22 gauge. And then I have the syringe, 3 ml syringe. Clean gloves, clean alcohol swab. This is going to be my patient arm, and the proper trash receptacles, so we can dispose of everything. And before even touching this, we wanted to do hand hygiene before we get ready to actually prepare everything. So hand hygiene has been done. So what we're going to do now is we're going to prepare the medications. So let's get rid of 7 ml. That'll leave us with 3 ml. Remove the cap on that. Dispose of 7, 3 ml. And then we're gonna go ahead and screw in our needle. Actually, what we're gonna do is we're gonna clean off with an alcohol swab the vial before I even have the needle in my hand. All right, drop the air. That's going to be 2 ml. Put it in. Draw it up. Let's see if I still have any more in here. I drew it up so many times practicing. We're going to make sure that we have no bubbles. Okay. Perfect. And then using the scoop method, we'll go ahead and put this back into the plastic. All right, so now we're going to go ahead and go to the patient room. What is your name, date of birth? Ellen Davis, 9/19. No known drug allergies. Well, first of all, my name is Rel. I'm going to be your nurse, and then I'm going to verify the patient date of birth and the name. Then I'm going to tell them about the medication and then what it's for. So this is furosemide. We're going to be doing a 20 milligrams IV push, so into that little saline lock that you have over there on your arm. And then this is going to be for weight gain over 3 pounds in a 24-hour period or symptoms of fluid overload. And then we're going to flush with some saline before and afterwards. So now that I verified all of that, I'm going to use proper hand hygiene, glove up, and then we're going to administer the medication. All right, so we're going to assess. No redness, edema, signs of infiltration. All right, everything looks good. So we're going to vigorously scrub for 15 seconds. The saline port where we're going to connect it. And then after that, we're going to go ahead, 0.9% sodium chloride, 3 ml. We're going to go ahead and put that in, and we're going to push that. All right, dispose in the proper trash receptacle. Then we're going to go ahead and vigorously scrub again, 15 seconds. With the clean alcohol swab. After that, let's verify. So we have furosemide 20 milligram. This is going to, I have 2 ml in this syringe. We're going to be giving 1 ml every 60 seconds, 0.5 every 30 seconds. So everything was correct on the MAR. Let's get ready. So let's unscrew the needle. And then we're gonna go ahead and connect. And then this is going to start now. And before going into the patient's room, I want to make sure that I had labeled the medication as well. And I don't know if I said that before, but I want to make sure that this is labeled with furosemide, the dosage, any expiration dates. All right, 30 seconds has gone by. That's already 0.5 ml. All right, a minute has gone by. That's 1 ml. 1 ml. You can hear my dog in the background. All right, that's 30 seconds, another ml, or half of an ml, so now we have 0.5 left to go. All right, and then that was 2 ml over 2 minutes. We're gonna remove and dispose of the proper trash receptacle. Double checking, no redness, no infiltration, no edema, everything looks good. So now we're gonna go and clean off the side again for 15 seconds using a clean alcohol swab. Then we're going to flush it with 3 ml of the saline. And this one we're gonna do, this is 0.9 sodium chloride, everything looks good, 3 ml. This one is going to be a little bit slower just because it already has medication in the tubing. All right, so now that that has been administered, we are going to unscrew and then dispose in the proper trash receptacle. Now that that's done, we're gonna double check again. Okay, no signs of redness, no infiltration, no allergic reaction, everything looks good. So what we're gonna do now is we're gonna dispose of everything in the proper trash receptacles, make sure that the patient is in a safe position and has tolerated everything well. Then we're gonna go do hand hygiene, or gonna take off the gloves, do hand hygiene, and then we're gonna go ahead and document that we gave the medications. All right, thank you so much.